You probably must have heard about Mpox and wonder what it really is. Mpox, formerly called monkeypox, is an infectious disease caused by a virus transmitted to humans by infected animals. Though it isn't a new virus, the World Health Organization says there is a new strain that seems to be spreading quickly and little is known about it. In this story, Just Nigeria's Mercy Frank brings you an explainer about the virus, what Nigeria is doing to protect its citizens, and what you must do to stay safe. Have a look.
In a world grappling with rising living costs, political turmoil, and very devastating aftermath of COVID-19, a new threat emerges.
I had to call my family doctors because the doctors there were avoiding me.
Mpox, once a distant concern, is now knocking on Nigeria's door. But can Africa's most populous country weather the storm?
If we are waiting for the cases to become quarter to, when people are coming in severe pain, requiring what we call high dependency care, then no.
Mpox, formerly known as monkeypox, is a viral illness that experts say can cause fever, rash, and other symptoms. The World Health Organization recently renamed it, reflecting on a commitment to reduce stigma and promote understanding.
The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying.
It's a virus that has been circulating for years. But recent factors like increased global travel and changes in the virus itself have contributed to the outbreak becoming a global health concern.
Two different main clades of the monkeypox virus. One is clade 1, which is currently spreading in the Democratic Republic of Congo. And then there's clade 2, which is associated with disease in West Africa.
Nigeria's Center for Disease Control and Prevention, NCDC, reports that until 2017, the last time that cases of monkeypox were reported in Nigeria was in the 1970s. It also states that the 2017 Nigerian outbreak is the largest documented outbreak of the West African clade to date, with 4,540 suspected cases and 17 fatalities across the country. Data from the NCDC as at July 14, 2024 indicates that since week 1 of 2024, 19 states have recorded at least one confirmed Mpox case across 30 local government areas. So far, no deaths have been recorded.
We recorded about 39 cases confirmed out of about 738 suspected cases. But the key states there are Bayelsa, Cross River, Lagos State, Ogun State, I think Enugu, Ondo State, and Mboy.
These aren't just numbers, they represent lives. One of them is this man, whose identity will be kept anonymous. He says his world turned upside down when he started experiencing Mpox symptoms.
I was facing headache, constant headache, then fever, body temperature, dizziness. I was indoors for a long while. I couldn't move, lost appetite to eat also. And after 7 days, I started having rash all over my skin, and the rash kept on increasing different size all over the body.
He says isolation was the hardest part and that the financial burden was crippling.
We have to borrow money because the financial burden was very much on us as students, so it wasn't easy for us.
I know it's visible like boil, right? Okay, I think that's like all I know about monkeypox.
I'd like to know more about preventive measures.
To shed light on this complex virus, we turn to some experts.
This is not one of those diseases that affects what we call the extremes of life, the very young and the very old. No, everybody is at risk.
Those high-risk groups will include, of course, people with low immunity, people with HIV, pregnant women, children are expected to have a severe infection.
For person-to-person transmission, if someone comes in contact with somebody that has Mpox, you come in contact with their body fluids, come in contact with their clothing.
Nigerians should cook their food properly, especially when they're dealing with meat. Right. And also look out for folks that have any kind of rash.
If you have dogs or animals who look ill, the best is take them to the vet or to the nursing so that they can be treated again, and they have to be very careful when they are dealing with such animals.
Nigeria is expecting to receive 10,000 doses of the Genius vaccine on August 27 to help it curb the spread of the virus.
It will not even go anywhere. That will not even cover for just one local government in Nigeria.
If I have confidence in it, of course I will take it. But if I don't, I won't.
If we look at our COVID experience, we got the vaccines. Nobody would take them. If we look at the human papilloma vaccine program, we got the vaccines. People were hiding their daughters. Tomorrow, when you see an upsurge of cervical cancer, they'll say government didn't do anything.
We had some doses that are already within the country, but those doses are for NAFDAC to test. So the vaccines would have to be tested to be sure that they contain what it is said that they contain.
As the shadow of Mpox lurks around the corner, Nigerians share their concern, echoing the challenges posed by COVID-19.
I'm concerned that it might spread and it can actually become a pandemic like COVID-19. That everyone will not have to go back to lockdown and everything.
Our health facilities here in Nigeria are still not as robust as they should be.
It's a double whammy situation where we have diminishing numbers of healthcare workers, suitably trained healthcare workers, and an increasing number of cases, so to speak, patients, clients, cases, both of the infectious disease type and the non-communicable disease type.
And we're doing a whole lot of assessments to ensure that we know which health facility has the required number of staff, and also in terms of functionality and what are the equipment that are available.
So, what are the next most crucial steps to take should one contract the Mpox?
Go to the nearest health facilities. The health workers have been trained on exactly what to do. So they'll move the case to the referral center.
If the doctors have the necessary material to work with, they will be more comfortable, treating such patients. But if they don't have even gloves, they may not want to even touch a patient that has a monkeypox. You can't touch those lesions with your bare hands.
While data from the NCDC indicates lower number of infections in Nigeria, reports from the World Health Organization show that countries like the Democratic Republic of Congo have recorded thousands of confirmed cases with hundreds of deaths this year alone, birthing a coordinated international response that survivors and stakeholders say should accelerate funding for research, diagnostics, and vaccines to contain the spread of Mpox and save lives.
We must all do what we can to stop the spread of Mpox in our communities. What are you doing to keep safe? Share your stories with us on X at Just Nigeria TV. We'd like to hear from you.